My question is about the India variant and whether you are considering classifying it as a variant of concern and why.
So thanks very much for the question. I assume you're talking about the B1617 virus variant that was first identified in India. Indeed, this is one that has been classified as a variant of interest by WHO. Over the weekend and last week and into today, our EPI team and our lab team has been discussing with our virus evolution working group this variant, this B1617. And everything that we know about it in terms of transmissibility and any studies that are being done in India as well as in other countries where this virus variant is circulating. It is important to note that this lineage, this B1617, has 3 sublineages, the 0.1, 0.2, 0.3. I won't go into that level of detail. All of that will be provided in our SITREP tomorrow, where we will outline all of the information that we know about each of those sublineages. Having said that, in consultation with our virus evolution working group and our EPI teams and our lab teams internally, there is some available information to suggest increased transmissibility of B1617. There is a preprint that is out, so this is a paper that has not undergone peer review, and it's of a limited number of patients suggesting that there is some reduced neutralization, and as such we are classifying this as a variant of concern at the global level. There will be much more detail provided in our SITREP tomorrow around all of the available information that we have. What we do want to say is that even though there is increased transmissibility demonstrated by some preliminary studies, we need much more information about this virus variant in this lineage, in all of the sublineages. So we need more sequencing, targeted sequencing to be done and to be shared in India and elsewhere so that we know how much of this virus is circulating. We need more information on the epidemiologic studies that are underway, the studies that are evaluating neutralization, severity. So far, from the information that we have, the public health and social measures work, but we need to work that much harder to control any virus variants that have demonstrated increased transmissibility. We don't have data yet on diagnostics, therapeutics, and vaccines. But we don't have anything to suggest that our diagnostics, our therapeutics, and our vaccines don't work. This is important. We will continue to see variants emerge. We will continue to see variants of concern around the world, and we must do everything that we can to really limit the spread, limit infections, prevent the spread, and reduce severe disease and death with the tools that we have at hand. So much more work is being done around the world with our partners. We do have this global risk monitoring and assessment framework for variants, and this is exactly why we have established something at the global level, which covers everything from surveillance to detect mutations and variants through a proper and robust assessment for each of these mutations and each of these variants of interest, as well as variants of concern. What this means for everybody at home is that any of the SARS-CoV-2 viruses that are circulating can infect you and can spread, and so everything in that sense is of concern. So all of us at home, no matter where we live, no matter what viruses are circulating, we need to make sure that we take all of the measures at hand to prevent ourselves from getting sick. It's the individual level measures, physical distancing, hand hygiene, wearing of a mask, avoiding crowded spaces, improving ventilation, spending more time outdoors as opposed to indoors if you can, work from home, all of the measures that are at hand, and ensuring that governments provide a supportive and an enabling environment so that we can carry out those measures that keep us safe. So more information on this variant of concern, the B1617, will be issued tomorrow in our SITREP, and we'll make sure that the link is made available. It's available on our website, and you should read that SITREP every week if you can. And we are very grateful for colleagues in India, as well as around the world with our Virus Evolution Working Group and elsewhere, who will continue to carry out the studies to help us properly assess what the impact of this variant of concern is. But so far, our public health and social measures work. We need to continue to do it all to limit the spread.